in the medical profession. First of all, we're fix-it people. We like to fix things. Also, I tend to think that we're optimists. We keep trying. We keep trying to come up with the best possible solution. And I think that's where joy comes in.
Our podcast frames joy, and we talk about joy. Hypothetical definition is that it's a combination of meaning, alignment, and delight. And it ranges from the mundane to the profound.
So how do we find these moments of meaning and connection and fulfillment in the midst of an unjust and unpredictable situation? And how do we hold on to those things?
You're listening to Solving for Joy. I'm your host, Dr. Chrissie, a multi-boarded integrative physician and professional certified life and career coach. This podcast is about joy, what it means, how we find it, and the creative ways people are solving for it in their own lives. I'm so glad you're here. Hello, friends. I am honored today to be joined by the one and only Dr. Bob Macauley, who smirks and giggles a little when I say that. No big deal. He's kind of, one of the pillars of ethics in palliative care. He's one of only a few hundred pediatric palliative care physicians, pediatricians specifically in the country. And he is also an ordained Episcopal priest, multiple divinity degrees, and masters in fine arts in writing, fiction, and has just released a book that is actually groundbreaking in that it is breaking ground, being the first to center the stories of children receiving palliative care. I have had the good fortune of clinical overlap with Bob for a number of years, which I count as one of the beautiful good fortunes of doing the clinical work that I get to do in the world. This is an opportunity for me to tell you, hopefully not for the first time or the last, Bob, that I am better because I knew you.
That's very kind, Chrissy. Thank you. It's a delight to be on your podcast and right back at you in terms of my appreciation for the opportunities we've had to work together and to get to see the amazing work you do.
I receive that as very high praise indeed, coming from my friend, Dr. Bob Macauley. Thank you. So, our podcast frames joy, and we talk about joy. My, hypothetical definition is that it's a combination of meaning, alignment, and delight. And it ranges from the mundane to the profound, as do many things in our work. And while it may not be intuitive to a casual listener that we're going to weave joy through palliative care for children, we are going to do that. And I'm going to start by asking you about a recent tiny little joy, something that has just brought you a bit of delight and pleasure in this last recent period of time.
Well, that one thing immediately comes to mind. So one of the kids I talk about in this book was a baby when I knew her named Cora. And she taught me a huge amount about the assumptions that I was making and some things that we used to teach students in medical school, like when I was in medical school, that no longer were true. And because of the fierce advocacy of her mom to fight for her and give her every chance, I learned a lot. I think people around me learned a lot. And the reason that she came to mind is that this was 12 years ago that I got to know her when she was born in Vermont. Her family subsequently moved to Iowa, and last month her mom ended up going to a family function here in Oregon. So we got together for brunch, and I hadn't seen her in almost 12 years. And I'd sent her a copy of the book. We'd obviously talked a lot about it because all the patients that I was still in touch with, their families that I wrote about, they were part of this. And so we had this wonderful opportunity to reminisce together. And Cora's now 12 years old and has a little sister and is still defying expectations. And it was an utter joy to be with her mom, whose name happens to be Joy.
That is perfect. I love everything about that. And to catch listeners up who haven't had the pleasure yet of having their hands on your book, Cora was born with trisomy 18, And historically, habitually, we are taught that that is a genetic mutation incompatible with life or long life. And after she taught you that that teaching was insufficient, you taught others that that teaching was insufficient. And we, in fact, have cared for a baby with trisomy 18 together. And all of that is, it's just something to behold, isn't it?
It is.
One of the things that I feel comes right through in this book, and something that I know about you, is that you speak what's truest when you can. And it sounds like I learned to a new extent in this book, despite risk and consequences, interpersonal, professional. You detail some difficult professional relationships in the book, which I think was so brave. And as somebody who has been working in physician wellness and coaching physicians for years now, I see that as such a common theme. It still surprised me, honestly, because I think so highly of you and I know the caliber of your communication and presence, Bob. There's a part of me that feels a little bit shocked that somebody would malign your motivations and intentions. And, that probably highlights that I have some pedestalization in my admiration for you and fondness. But it is what I felt as I was reading this. And so my heart goes out to you in that experience, and really unites with many highly performing, incredible individuals who have faced similar sort of tall poppy syndrome experiences where there is disdain rather than support at their growth and exploration. I wonder if there's more to contextualize that with here.
Yeah, no, I appreciate that very much. I think a couple of things come to mind. So one of my favorite quotes, which I quote in the book, is from Rita Mae Brown, who said that good judgment comes from experience and experience comes from bad judgment. So, maybe you're just catching me at a very experienced part of my life as a result of bad judgment used in the past. So there's that.
Yeah.
I also think that one of the other quotes in the book is from Maya Angelou, who said something to the effect of, people won't remember what you said or what you did, but they'll remember how you made them feel. And so I look back, and I'm not the first person nor the last to have workplace conflict.
Right.
Like anyone who's had a job for a while probably has had somebody they're like, I don't get along so good with that person. And it's always a two-way street. So my hope in the book is not that I portrayed myself as like, I did everything right. No, this person's not a good person. It's we didn't work well together in a certain situation. And part of my task, I think, is to try to figure out what I did, whether intentionally or unintentionally, in order to create that situation and how I could do better in the future. And not to be all Socratic about it or anything, but it feels like I'm saying more and more often, I just don't understand over and over again. I think I probably thought I understood more 10 or 20 years ago. Clearly I didn't, assuming I just haven't forgotten a lot of stuff in the meantime. So I think that there are things that I wish were different in the past, and part of my journey has been letting go of those things and not really being able to completely explain why things were the way they were, even though for some strange reason I still try. Like you would think, given the work that you do and I do, and caring for kids who are facing challenges that they in no way deserve, why I'm still trying to come up with reasons. Eventually, maybe I'll just give that up. A wiser person probably would have given it up long ago, but I'm still searching.
It's a hard habit to break.
Yes.
I think you couched it in no uncertain terms as a two-way street. One of the marks of a beautiful memoir is, that the author grapples with something important and has a coming to terms, which you define coming to terms in a very specific way towards the end of the book, which I really appreciate. And, not too many spoilers, but there's a sort of climax in the book where you're faced with two blank pages, which I loved and could not have like how perfect was that? Will you tell our listeners a little bit about what that 2 blank pages was about?
Sure. So, as I, in the book, was facing a fair amount, or maybe more than a fair amount of loss in terms of the patients I was caring for. And then, in addition to that, the very sudden and unexpected death of my best friend. I was grappling with what that meant. And especially coming from a background of faith, as you mentioned earlier, I'm also an Episcopal priest. And so people would sometimes look to me to help them understand stuff.
Yeah.
And so I built up to this moment in the book where I said, I'm faced with loss that I can't explain. How do we understand that in the context of a parent losing a child? How do we understand that in the context of a loving God who purports to care about us and has the potential to intervene and clearly did not in certain cases? And so I built up to this moment where I said, I seem like the perfect person to ask this question to. Like, I am an Episcopal priest. I'm a pediatric palliative care doc. Heck, I even wrote my master's thesis on the problem of evil.
Clinical ethicist, yes.
Exactly, all that stuff. And I said that after all of that, this is what I've come up with. And then I left 2 pages blank. And it was my way of not just glossing over it, to not just say, hey, I'm not sure, or here are some ideas, but I think it required a real stop. It required, my hope was that the reader would be like, wow, there's blankness here, there's emptiness here, because the loss and the suffering that certain people and families have undergone, it merits more than just a, hey, I'm not sure. It merits a full stop to say, what does this mean, rather than glossing over or moving on. And those 2 pages actually created kind of a whimsical moment too, which is when a couple of weeks before the book was released, I gave copies to every member of my team, inscribed to them, and talking about how much I appreciate them. They knew the book was coming out. And I gave it to them. I said very clearly, this is not a homework assignment. You can choose to read it if you want. You don't have to. You can choose to talk to me about it if you read it or not, either way. And then I got this fairly frantic text that afternoon from one of my team members to be like, Bob, I don't know how to tell you this, but there's a typo. There's a printing error. There are 2 pages that are blank in the middle of the book. Like, quick, before it gets out into the world, you have to stop this so you don't look foolish. And I wrote back and said, thanks for caring about me. And actually that was intentional, and you'll understand when you read it, if you do.
That's fun. Yeah, I love that there's a time and space built in to kind of grapple with how unanswerable these questions are from our vantage point as humans. Also, thank you for letting us love Christopher with you. Thank you for sharing him with us. That's Bob's best friend who we lost to sudden cardiac death. And what a wonderful friendship you described.
And for Chrissie, you having read it, and for whatever of your listeners end up reading it, I mentioned that one of the things that I have kept, even though he has now been gone for over a decade, is his fleece, which, as
are you wearing it right now?
You can see it. I'm wearing it right now. I wear it all the time.
I loved that. Yeah. That's special. One of the things in this book that brought me some really fun smiles and joy was your love of Buffy the Vampire Slayer, references to Princess Bride and Top Gun and Wicked and more. Just so fun.
Well, I like to be eclectic. Sometimes when I'm giving a lecture and I draw different quotes in, I'll actually, at the very first slide, if I'm using PowerPoint, I'll put pictures of all the people I'm about to quote and kind of challenge people in the audience to be like, can you imagine how we're going to pull together, in this book, for instance, Buffy the Vampire Slayer and Elie Wiesel and Maya Angelou, and like, I'm not sure people could do that. And I hold out this hope. I don't know if she listens to your podcast, but I'm one of these people. My kids make fun of me because I'm one of these folks who, like, nothing ventured, nothing gained. And if there's no downside, why not give it a try? When we go to concerts, when people come through Portland that I like to listen to, I will not uncommonly write them letters in advance to be like, hey, if you're on tour and you're bored of restaurant food, come over to our house and have a cup of tea and meet my family. Okay, very rarely does it work. But the reason I bring it up is I did track down, to the best of my ability through Google, an address for Sarah Michelle Gellar, who played Buffy, and I sent her a copy of the book with a little tag on it, with a tab on it with the references to Buffy. And so my hope is that at the very least it reaches her and she realizes, in the midst of so many people that that television show has touched, that it also touched someone that she might not have expected, like this 58-year-old guy.
That is so delightful to me. That sounds like an element of surprise for Sarah Michelle Gellar, and yeah, unexpected for sure.
Yes.
You did this beautiful job of simultaneously titrating and disclosing your own history of sexual abuse, Bob. And I can't imagine, making something so private, personal, painful, public, and doing so as, a highly visible professional. And I don't have so much to say other than to just like deeply acknowledge that you did that skillfully and you titrated it with some consideration and not, shock value. And it makes it feel safer for people to acknowledge their own or people close to them. And as bringing it to the light is part of the healing and de-isolating it. And, you also talk about how your suffering has deeply informed this mission imperative to interact with and alleviate suffering in other kids. Thank you for transforming it, and thank you for sharing that painful part of your story.
I appreciate that very much. I think that a quote that has come to mind frequently as I've thought about this book is Janis Joplin has this great line of, freedom's just another word for nothing left to lose.
Yeah.
And my riff on that of late has been, freedom's just another word for nothing left to hide. It takes work to keep secrets, to wonder, does this person know this about me? And oh my gosh, I hope they don't. And there is something very liberating about giving that one up, because at this point, any person who wants to go into a bookstore or click on a link on a website that sells this book can read about all that stuff. And so I think that that's been very freeing for me, which I really appreciate. It's also been an interesting evolution, because when I wrote the first drafts, after a few revisions of this book, I sent it to about 3 people that I really respect. And the feedback I got from them independently and uniformly was that it needed to have more of me in it. It was a little bit of a removed observer role. And so I revised it multiple times. And with that came significant concern on my part, because I felt like I had to find the right balance, that too much of me detracts or distracts from where the focus should be, which is on these kids and their families. Too little of me doesn't really do justice to how they have impacted my life. And increasingly, as people have asked me, how can you summarize your book? First of all, that's a challenge. Second of all, if I were to, I would say, and I say this in the last chapter, it's really a thank you note.
Mm-hmm.
It's really a thank you note to these kids and their families for showing me how brave and wonderful and generous people can be. And so I wanted that to really be a thank you note. And one of the interesting pieces is that all the families that I worked with on this book, they knew what was in their chapter because we had talked about it. I had sent it to them. And when the book was getting ready to be published, I said, hey, I'll send you the whole thing if you want. And they were like, pretty much to a one, they're like, no, that's okay. We'll just wait to read it when it comes out. So they had never read the whole thing. They had just read their parts. And I was worried, really worried, that it wouldn't strike the right balance. And I have a love-hate relationship with social media, mostly hate, but this is one of my love moments. One of the moms in the book put a post on Facebook when she had read the whole thing. And the last line was something very close to, "We always knew what Bob meant to us, and now we know what we meant to him." And when I read that, I was like, dang, I think I might have hit that balance, because that's exactly what I wanted, that the focus is in the right place, but you all know what an impact you made on my life.
That is beautiful. I think the mark of a good thank you note is that the writer shares how the gift impacted them.
Mm-hmm.
You don't just describe the gift. So I think that you did nail it for that purpose. And I'm glad that there was more of you in it, because it's necessary. It's necessary. And it's generous to let the reader know more about you in this journey through time. I remember meeting you in our first consult, shortly after your arrival in Oregon. And I think back to, what was happening for you in that move, and certainly would never have known. You mentioned this multiple times in the book, cis het white male with resource privilege and education privilege. And Robin Williams' very poignant quote, like, "Everyone you meet is fighting a battle you can't see." I had no idea, that you were anything except just ascending the, professional ladder, right? And so it means something to me as a professional colleague and friend to just have a fuller picture of that context.
I appreciate that. And I think that having those privileges, is in so many ways a blessing. And I don't mean to overlook that at all. At the same time, I think that it makes it harder for people to see the real you unless you take steps. Like, I'll always remember the example. I've shared this with my kids multiple times. When I was in seminary, the dean of my seminary, I knew sort of in passing, and I was going through a lot of stuff. I was doing a lot of thinking, a lot of feeling. I was in therapy for the first time. I was beginning to grapple with my childhood in a substantive way that I'd never had before. Like, my world was kind of getting rocked. And
Yeah.
it was the welcome back picnic, my last year of seminary. And the dean, who I'm sure is a very well-intentioned person, came over and said, "So how are you? Yeah, how's it going?" And I said, "Fine." Like, I lied, because, that's the polite thing to do. When people say, "How you doing?" most of the time, they don't really want to know. They're ready for you to say fine, and then say they're fine, and then you move on. And so I said, fine. Maybe I said it in a slightly kind of, maybe I paused for a sec to be like, "Hey, if you really want to know, I'll tell you." I don't know if I did. I said that. And he paused and he said, "Bob, I can't imagine you not being fine." And I remember thinking to myself, and I can't imagine ever sharing anything important with you. Like,
Yeah.
if you can't imagine that, then you're not ready for it. And so I try really hard when I see people who seem like they've got it all together. It doesn't take much work for me to conclude that's not true. Nobody really does. Some of us just hide it better than others.
It's so true. You can think of 1,000 examples, personal and professional. Yeah. Privilege does not prevent all suffering, but it does sometimes make it harder to see.
Mm-hmm.
I am not a book reviewer, but I do love good books, Bob. And I think this podcast is not just about praise for your book, but there is a lot of it. And so I can't help myself but just to tell you that, like, the sentences were beautiful. Like, it was a pleasure to read for hours on end.
Well, thank you. I appreciate that so much. I am, like many writers, I'm sort of a thin-skinned person when it comes to my writing. And The reviews, generally speaking, have been really great, which has been so nice. And of course, I hold on to the ones that haven't.
Of course,
And
negativity bias. Thank you very much.
exactly the ones that haven't they've not been bad. No one's really that has taken the time to write something to be like, I hated this book. But there was this one person, like, I don't know if this person is out there. I only know what their moniker is on Goodreads. Canadian Reader. I always thought Canadians were so nice, but Canadian Reader called the writing clunky. Like, my kids they make fun of me because they're like, Dad, have you gotten over the clunky comment? I'm like, no, I haven't gotten over the clunky comment. I really don't think my writing is clunky. So anyway, I appreciate that very much.
They might have an oculomotor disorder and their reading is clunky. Bless their hearts.
Bless their hearts. Yeah. So I don't know, like, that one's going to stick with me for a while, but I do wonder about what it says about us. I do the same thing with, like, teaching evaluations. I do some talk, and, like, X percent, very high percent are really nice things. And then, like, low percent are like, well, I wish you'd done this, or I could have done that better. And I always hold on to that stuff. So I think I'll always be that way.
Oh my gosh, I resonate with that so much, Bob. I have a few of my handwritten evaluations from residency still in a file tucked far, far away. And I remember of all of them, the ones with the quick, pleasure to work with, they fade in the background. But the one that I remember the most is a pediatric ER attending who described me as difficult to work with. And I'm sure that was an honest appraisal of her experience of me, because I was less, what's the word? It's like subservient, but like less submissive, less passive than the average pediatric resident as a fourth-year med peds resident who was already a few years older and had a little bit more out in the world experience. I was different than her average person, but that evaluation still right there with me. Ouch.
I can totally relate to that. I think that sometimes that, for me, is perseveration, but sometimes it's actually the beginning of great learning. So I remember, I quote this all the time. I'm of an age where role play was not something that we did in medical school. These days, medical students do a lot of role plays, which is fabulous. I never had that because it hadn't really gotten to be in vogue back then. And so when I was coming back around to try to get some training in palliative care as somebody who did not do a fellowship and kind of, as they say, grandfathered or grandparented into the specialty, I sought out every experience that I could. I'd read a lot of books. I did a lot of stuff. And by this point, I'd been practicing for about a decade. And so I did this very intensive palliative care training course where it was my first real experience with role play. And I was working with another physician who actually didn't complete the course. I don't remember her name. This is now almost 20 years ago. I'm still talking about it. And we did this role play where she was a patient and I had to break bad news, kind of bread and butter of what we do in palliative care. And I had done a lot of reading. I had sort of, gone through what scripts you're supposed to do. And I tried my very, very best. And when I got done, I certainly acknowledged that it was not perfect, but I thought it was pretty darn good. I tried my best and I was a pretty thoughtful guy. And I'll always remember what she said to me in her feedback. Very close to this quote. She said, Bob, I really love what you have to say. And I really wish you'd shut up sometimes. And I learned so much. I'm still learning from that comment, which is that silence is so important. And sometimes you might have the best possible thing to say and it should not be said. And I think about that so much. And if she had only stopped short and just been like, I really love what you have to say, I would have learned a fraction of what I learned from her, for which I'm incredibly grateful she didn't stop there.
I certainly sometimes hear myself still speaking when an awareness is dawning that this should be a time for quiet.
Yes.
And try to respond to that by fading out.
Mm-hmm.
I think the only role play that young trainees probably did when we were training or when we didn't have role play set up is that real life became role play. We were playing the role of clinician,
Mm-hmm.
but with real patients.
Yes.
Lots of on-the-job training.
Yes. And I'm so grateful nowadays that people get the chance to practice some stuff, not in a real scenario, because that is important. Like that, I wish you didn't have to make your first mistake when there was a patient there who had to hopefully not suffer, but experience that. So I think that we've come a very long way. I also
Yes.
realize too that no matter how much you role play, it's always different in real life. Like you can try to, even with the best, if you have standardized patients or actors playing patients who do, in my experience, an incredible job.
Yes.
There is still something that you can't quite get to actual reality because there's a little part of you in the back of your head that says this isn't real and this is not a parent who is about to lose their child. And when you're in the room in the real world, it feels a little bit different. It has to, but at least you're better prepared than I think that many of us were back in the day.
Absolutely. I didn't know, and it makes sense given the time frame, that you were a palliative care physician who did not do a fellowship, who grandparented in, as you say. And what I take away from that is how powerful deciding to become something is, because you are, and other people I know in this field who are not fellowship trained but are very much consummate palliative care professionals, are no less than. Even if there is a protective or turfy sense from some who are fellowship trained, a little one-upness, I wish there weren't. And sounds like it's a very human tendency, but I hold you up as, in this case, Exhibit A. You do not need a fellowship necessarily to become just a preeminent leader and pillar in a field.
Thank you. I think that I am a little jealous sometimes of people who do fellowships because they do have the opportunity to have others looking out for them with clear milestones that need to be achieved and a sense of validation that you have achieved that milestone.
Yes.
And really important skills. And for those of us who meandered around and found our way and cobbled together experiences, you never really know when you're ready, or you never are sure if you're really good to go. And I also think that the field, especially pediatric palliative care, has come so far that when I first started practicing 20 years ago, the national meeting, the annual assembly of the American Academy of Hospice and Palliative Medicine, I still remember there were probably 20 of us who did peds. None of the sessions were specific to peds. And we would just kind of, as a big group, as not a very big group, as a small group, we would wander around and try to find some content that had any bearing on what we did.
Yeah.
And nowadays, there's a ton of pediatricians and pediatric folks going, and there's like a pediatric track through that. So every time somebody says to me, man, I wish there was more pediatric content at the annual assembly, I'm like, well, let me tell you, back in the day.
Exactly. I was fortunate to attend the Harvard Palliative Care Education and Practice program, which you know well, in the pre-pandemic times. And I was so grateful there was a pediatric track. And we were still a much smaller representation, rightfully so, in that there are many fewer individual cases, but still plenty. And it was such a transformative training for me. It has been just a touchstone and confirmation that providing palliative care in the context of pediatric complex care is certainly part of the calling that I feel in this work.
Completely agree. And actually, that story I told about the role play, and I really wish you'd shut up sometimes, that was at PSEP. So you and I share that foundational experience.
Oh, there is some intense role playing at PSEP, for sure. What would you give in terms of a thought about joy to someone entering this field or thinking about palliative care today?
Well, I think that I loved your definition of joy, that you mentioned a little bit ago, because I think that when people hear joy, first of all, I don't think it's a term we use super frequently. I think people talk about, happiness, contentment. And when someone talks about joy, I kind of wonder if they are using it in two very different ways. One is sort of like, you know, um, zippity doo dah, skipping down the yellow brick road kind of thing, which is a bit of a shallow notion, I think, of just perpetual happiness or something like that, as opposed to
Yeah.
joy in a much more meaningful way, like you use the term. Um, and so I wrote an article, a reflection piece a few years ago that comes to mind. It was called, somewhat surprisingly, The Selfishness of Pediatric Palliative Care. And when people saw the title, they're like, that's weird, right? Like, isn't pediatric palliative care all about selflessness and self-sacrifice and entering into suffering? And like, to some degree, there's certainly the entering into suffering. At the same time, I think that there needs to be this balance, which is we shouldn't, I don't think, do our jobs just for what it gives us, like sort of the warm fuzzies that you get from having helped somebody, because that becomes very self-centered. At the same time, if the only reason we do this work is a sense of duty and selflessness, I'm not sure I'd really want someone working with me who got up in the morning every day and be like, oh gosh, I have to go to work. I hate this job so much, but it has to be done. Like, that's not really what you want to be working with either.
Martyrs are not that much fun.
So, I think you got to find the balance between those two things. And for me, it is a resetting of expectations, which is to say that we all know what we want out of life, that its core fundamental element. And really, the trick with joy is figuring out how to find that when your number one thing is not possible. In our work, we ask people a lot of sacred questions like what they hope for. Yeah. And so when we have learners come through with our team, of which we have many, I'll ask them, how many times have you asked a parent what they're hoping for? And usually it's like never, because it's sort of an unusual question in medicine, although it's bread and butter for palliative care. Yeah. And so I say, well, if you were to, what do you think they would say? And they'd be like, I'm, parent of a kid with a serious illness. They'd say, I want my kid to get better and live a long, happy, healthy life. I'm like, absolutely. And if you stop there, have you really learned anything? Like, you knew that before they answered. You had to ask them what else they hope for. Because if you can't hit the number one, you got to figure out what else you can try to achieve. And I think that's where joy comes in, which is like, I would love it if everybody got healed and cured and they led happy, healthy lives. Don't get me wrong, but I know that's not going to happen. So how do we find these moments of meaning and connection and fulfillment in the midst of an unjust and unpredictable situation? And how do we hold on to those things? You mentioned, we started off talking about Cora and trisomy 18. And when I was trained I was taught that the median life expectancy of trisomy 18 is a week. It actually hasn't changed a whole lot. But that depending on the treatments that you give, sometimes that median life expectancy can increase. Some of the early studies coming out of Japan, where they treated kids intensively regardless of their diagnosis, were more like 5 months. And some people might be like, that's still really short. I'm like, yeah, but to those parents, like, the difference between a week and 5 months is huge. And not to say that 5 months is all you can hope for, because you can hope for more, like Cora evidenced. So I think that it's all about what our expectations are and cherishing moments that you wish there were more of them, but there's one right here. And how can we hold on to that?
That is beautiful. It reminds me of your quote in the book about holding your child for their whole lives, which just gives me chills. And like, what a divine inspiration to give those parents that framing.
And I would say too that wasn't some slick thing I'd been working on for a long time. It just
dropped in.
Yeah.
And that's why I use the word divine.
Mm-hmm. Exactly. So I'm grateful that seemed to have resonance in that moment.
Some of the most difficult experiences that I have had, whether in symptom management or, kids with serious life limiting illnesses, have been when the medical team and the family were out of sync in the direction of medical team actually wanting more for the child than parents. We've been involved in a situation like that together. And you describe one of those such situations in the book where a parent of a child who was suffering from a neurological condition was not willing to treat their pain because of their own fixed beliefs about pain management and distrust of the medical system, which I find is often at the root of those times when we're out of sync. I'm not leading up to a very specific or well articulated question here, Bob, but I just think there's something there to talk about, because it's relatively unusual that the team feels strongly that there should be intervention. For me, I'm not sure that that's the case for you, but for me, it's relatively uncommon. And then that loss of trust in the relationship is so palpable and difficult to recover from.
Mm-hmm. I certainly agree with you that it's not super common. I think that it's probably more common for parents to want more than the medical team does, because the medical team may be having an understanding of the likelihood of benefit.
Mm-hmm.
And also, I think that it is just such an unnatural thing for a parent to not try something that even has the remotest chance of saving their child.
Or relieving suffering.
Exactly.
Mm-hmm.
In those rare instances where a parent may not be in favor of as much as, especially from a symptom management standpoint, as the team, like in that example, I think that curiosity and a sort of humble inquiry is a key thing that sometimes we gloss over. Like we feel like we have, for noble motivation. It's not like I'm talking about physicians being like, I'm the doctor, I know best, but you want to help this kid, right? So you're being driven by noble motivation,
Mm-hmm.
and you know what you can do. And you have hopefully, I would imagine, nuanced understanding of what it is you are doing that is potentially not as impacted by perceptions or connotations or stigma, like related to the use of opioids or something like that for pain management. I think that in the mediation and negotiation literature, there's an important distinction between positions and interests. So an interest is, say, relieving suffering. The position is we should give morphine for this.
Yes.
And I think that one of the challenges we run into is we get into a battle of positions. Like, I want to use morphine, parent says no. And I say it louder,
Mm-hmm.
hey, I really want to, and the parent says no. If we can pull back, I think our interests may actually be not dissimilar. And if we keep backing up away from the specifics to the generalities until we finally get back to the same generality that we have subsequently taken divergent paths, then maybe if we can meet up there, we can figure out a way to move forward. But it doesn't always happen that way. And I think that those are the cases that keep us up at night for a good reason.
It takes some pause and some presence and some reflection, and sometimes the steadying hand of an experienced colleague to bring us back from the brink of entrenched positionality.
Agreed.
And it may not ever get easy.
I also think that we are inherently in the medical profession. First of all, we're fix-it people. We like to fix things. And I tend to think that we're optimists. We keep trying. We keep trying to come up with the best possible solution. And one of the things that I think both ethics and palliative care have in common is they're both really the search for the least bad option. Because if there was a good option, someone would have figured it out and we'd be doing it. And that's tricky because if it's a least bad option, it still means it's not great. And so how are you going to choose between them? The different choices you have is a complex question.
Yes. I love the nuanced multi-layer, what do you hope for your child? And I'm going to offer that question to you as books are a version of our creations in the world, children, what are your hopes for your book?
My hope for the book is that people who may not be super familiar with the work that you and I do come across it. So when you are pitching a book to try to get somebody to publish it, they always say, who is this going to appeal to? And the obvious question, or the obvious answer, which actually may not be the right answer, would be people in our field. So I'm not actually sure if that's true. I've talked to people in the field who very honestly say, look, I do this all day. I don't really want to read about it at night, and I said, I totally get that. But I would love to think about people who don't know much about what we do. Maybe don't even know that people do what we do, because it's more pleasant to think that kids don't ever suffer and certainly don't ever die. But if they were to dare to think about it, I would hope that this book shows them that it may not be what they assume. And I think that people often assume that what we do is just unbearably sad with unrelenting sadness, and there's no joy in the work, and that nobody ever actually gets better, which oftentimes, thankfully, kids do. And even if they don't, there still can be joy. And if there's that sense of surprise, like, I didn't know that. If they know that now, I would love that.
Thank you for that answer. It is a bit of a remitting and relapsing sadness that accompanies, and thank goodness for the remittances. I really enjoyed picturing you playing cards and games with the young girl at the beginning.
Grace.
Yeah, that's right. Grace.
And she didn't go easy on me in the card games list, that's for sure.
I love that you remember that. I bet she would too.
And it's been really lovely, the occasion of the book, to reconnect with various people along the way, like the parents of the kids in the book, and also various folks like that story that you just mentioned. The great sort of culmination of that chapter was Grace getting to go and see Broadway, and the then nursing student, now nurse practitioner, who was far more creative than I and pulled that one off, and I was along for the ride. She and I were able to get back in touch as a result of her being part of that chapter and me sharing the book with her, and even sharing some stories about the two pilots who volunteered their time to fly us down to New York. And it was really an occasion to bring people together and remember how, like, it's always funny when people say, what do you do? I'm like, well, I practice pediatric palliative care, but that's actually not accurate, because you can't really just, you can't do it by yourself. And so I'm part of a group, an amazing team who does this. And not just the team who get paid to do it and are specialized in their field, whether that be nursing or chaplaincy or social work or art therapy or whatever. But I mention, I forget exactly the language I used in the book, about some generous, previously uninvolved person. Like, people come out of the woodwork and do the most remarkable things. And I hope that learning about those folks for the reader will be important too, that it's not just people who have a badge that says pediatric palliative care on it. It's people who step up to help somebody else. And the examples of that could go on.
I imagine the who it appeals to part was a large part of the too numerous to count rejections that you describe in the afterword or towards the end of the book. But I'm so glad that the right person was found. I'm so glad that this book made it out and is in people's hands. And if it's not obvious to my listeners, I will say it explicitly. Like, it is absolutely worth your time to hear these stories. They are beautiful. They are much to celebrate. I love having a mental picture of you sitting on the floor of FAO Schwartz with Grace.
Mm-hmm.
And like, that's part of the work too.
Yes.
It's a
agree.
joy to celebrate that with you, Bob. Yeah, it is. It's a joy to have you here. And may the book touch all the people it's meant to and produce good things for the OHSU Pediatric Palliative Care Program, to whom all proceeds from the book are distributed.
And thank you, Chrissie, for the work that you do both as a physician and also with this podcast. This has been a delightful conversation. Thanks for having me on.
My pleasure. May our paths cross again soon.
Yes.
Thanks again to Dr. Bob Macauley for your wisdom, tenderness, and clarity. I'm so grateful to call you a friend and colleague. Today, you invited us to notice tiny joys, to look for shared hopes, not just positions, and to practice the brave work of choosing the least bad option with love. Your 2 blank pages are always going to stick with me for a long time. Next week, I'm joined by Dr. Mel Thacker, surgeon and coach, host of Surgeons with Purpose podcast. And if you are a surgeon or physician feeling stuck, burned out, or hungry for alignment in a clear voice, this one will be for you. Quick note for physician coaches and the coaching curious, the Physician Coaching Summit is November 6th through 8th at Savannah Wellness Resort and Spa in Carefree, Arizona. It's an immersive, restorative gathering for physician coaches at any stage and physicians, leaders, and wellness champions who are using coaching in real-world care. Think rigorous learning plus generous community in a setting that actually helps you exhale. Details and registration at thephysiciancoachingsummit.com. And if you've been listening to these conversations over the past year, you already know we've been circling around some big questions. What joy is, how we access it, and why it can feel so elusive. If you've been curious about how these themes might apply in your own life, I'm going to invite you into something very special and new. For the first time on September 6th, I'm hosting a Solving for Joy half-day intensive. We'll gather virtually in real time and spend a few hours together exploring our own memories of joy, the components that make joy possible, and the obstacles in our lives that so often keep us from weaving it in. This is a space for reflection, connection, and deepening your own experience of meaning, alignment, and delight. You will leave feeling resourced and inspired, and I would love to see you there. The details are in the show notes and at joypointsolutions.com under the navigation bar services tab. I would love to see you there. And lastly, as always, I'm a doctor, but not your doctor. This podcast is for education and connection and is not medical advice. Please speak with your own clinician about your specific situation. Huge thanks, as always, to our wonderful producer, Kelsey Vaughn, and to Sue, my favorite human and steady North Star. Thanks for everything you do, my love. And may we all keep choosing presence, curiosity, and the tiny joys that sustain us, even in the hardest moments. Take care, everyone. I'll see you next Tuesday.